Kyrie, all three medical professionals I spoke with tonight tell me that the measles vaccine is really the best and only way to prevent the measles from happening to you, your children. Telling me this following that announcement, as you mentioned there, that there is a positive case of the measles in Howard County.
So measles can be a very deadly virus, and it's actually highly contagious, one of the most contagious viruses that we talk about in infectious disease.
A highly contagious virus found in Maryland. The Maryland Department of Health and Howard County health officials announcing Sunday a Howard County resident has a case of the measles. Officials would not give any other details about the patient except that they've recently traveled internationally. These are the locations, dates, and times health officials say people may have been exposed. The evening of Wednesday, March 5th at Washington Dulles International Airport and Friday evening at the Johns Hopkins Howard County Medical Center Pediatric Emergency Department. Doctors say the one way to combat the disease, the MMR vaccine.
The measles vaccine is extremely effective. So one dose of the MMR vaccine is 93% effective in preventing measles. 2 doses is 97% effective.
But if you don't have the vaccine and were possibly exposed, doctors recommend watching for symptoms for 21 days.
The symptoms can initially present like a lot of other viruses: fever, runny nose, cough. About 4 days into the virus is when people start to get a rash.
Howard County pediatrician Dr. Monique Swallow-Burke and nurse practitioner Bethany Fry, who are not involved in this specific measles case, say receiving the vaccine is crucial.
So the reason that we worry about measles is because it can have some really, really serious long-term consequences. It can cause encephalitis, which is basically an infection in your brain that causes brain swelling and can cause permanent brain damage.
Typically, children receive their first dose at 12 months, followed by a second dose around the age of 4. But Bethany says in recent years, she's noticed more parents becoming hesitant with immunizations. However, she says the science to support the shot is there.
The risks associated with vaccines are incredibly small compared to the risks associated with the illnesses we are trying to prevent with those vaccines.
And both Fry there and Dr. Burke, they both say that there is no current treatment for measles. And the Maryland Department of Health also added that this case in Howard County is not at all associated with the outbreaks that we're seeing in Texas and New Mexico. Live tonight, I'm Tori Yorgi, WBAL TV 11 News.